More research is coming out about side effects for COVID vaccines in children. There's confirmation about the increase in myocarditis and now an up signal in seizures and epilepsy in young children. Let's talk about it. Hey everybody, it's Dr. David. So, I've been talking for a long time about vaccines in general, about COVID vaccines, and that for each individual, we must weigh the potential benefits versus the potential risks, and not just for vaccines, but any medical intervention or lifestyle intervention for that matter as well. And which may be the right decision for one person may not be the right thing for another person. Now, there has been some conflicting information that has come out regarding seizures, and so I want to talk a little bit about that. Now, back in 2021, there first was research more about seizures following COVID disease. So we'll talk about the vaccines in a minute, but regarding the disease, when people would catch COVID and having seizures, okay? Now, I'm not referring to febrile seizures, seizures that happen because of a fever, which is something that is relatively common in pediatrics and is not something that is seen once the fever's gone, and therefore it is not part of a seizure disorder or an epilepsy, which is something that is much more long-term. So we're going to put the febrile seizures over here, acknowledging that it can happen, but it can happen with not just COVID virus, but influenza virus for vaccines following, other that are following vaccines. There were seizures that were happening after the original DTP vaccine, which is one of the reasons why they changed it to the DTAP vaccine, as an example. That was before I even became a pediatrician. So last millennium, but this is actually talking about seizures that are developing later on, and epileptic disorders that are occurring later on. Okay, now originally in neurology, which is one of the main neurology journals, this goes back to 2021, last November, so a year ago. I'm sorry, 2021, and so 2 years ago, and so at the more beginnings of the pandemic, and they had looked at about 150,000 people who caught COVID. Okay. And what they had shown was about 1 in 100 people who caught COVID back then, this was children and adults, developed a seizure disorder, again, not febrile seizure, but went on to have a febrile, a seizure or epileptic disorder that they did not have before. And 1 in 100 is a pretty significant thing to happen but what do we know so much about time after time, all the research regarding COVID disease, the cytokine storm, the increased inflammation of the brain, encephalitis, and as causes of seizure and epileptic disorder. So not overly too surprising that, especially back still when many people had not gotten COVID and it was their first time seeing the virus, that they would more likely, since they had no immunity to it, would develop seizures. It's unfortunate, but you can't say I'm overly shocked that that was the case. And of course, the numbers have changed as things have gone on because people have developed immunity to it. Now, in and of itself, one of the interesting things from that study in 2021 is they compared it to influenza. And they found that and again, we're talking about not the vaccine, we're talking about the viruses themselves, but there was actually significantly more seizures happening later on, epilepsy, when a person had COVID as opposed to the flu. Now, one could say, well, gee, don't lots of people already have some level of immunity towards the flu? We obviously don't know hundreds of years ago, thousands of years ago, for however long influenza has been around. We obviously don't know what the original, when it became a novel new virus to the world. We have no idea, obviously, how frequently seizures were happening then. But I can say it's probably not shocking, since most people in 2021 had some level of immunity for influenza, but still not immunity for COVID. Lots of people. Certainly there were people who caught it. Certainly people who had the vaccines. But of course, now many, if not most, almost all people have immunity against COVID, right? Okay, so interestingly, in this original study back in 2021, they did find that kids who, in particular, who A, had not been vaccinated, but B, were also not sick enough to go to the hospital where they would have been under closer treatment and protocols, those kids were actually the most likely to develop seizures back then. Now, things obviously can change. We should not at all be extrapolating information from 2 years ago due to changing herd immunity to what we're seeing now in terms of making decisions. I'm just reporting the information as the data kind of rolled on in. Okay. But again, the take-home message for there was that COVID disease can cause seizures, and more commonly than influenza. Okay. Okay, now we have some other research. Okay, now also the CDC has been collecting data on this for a long time, and they have actually found that about 3 out of 100,000 people who were vaccinated for COVID experienced seizures that occurred within the first few weeks of the vaccine. Again, not the first few days. So again, not the febrile, but that was a known thing. Okay, about 1 in 30,000 people. So again, pretty uncommon, but still, it was a number. Okay. Now, also VAERS, which is the Vaccine Adverse Effect Reporting System. That's the thing that you've probably heard about. This is when doctors and or patients or family members report vaccines, and this is what's called a passive system, okay? And they clearly have signal in that report about seizures. I'm not a huge fan of theirs, except for a potential signal identifier that requires more research for 2 reasons. Number one, we know that doctors overall have underreported vaccine reactions. This is true not just for COVID, but overall. I can't tell you how many patients I've seen in my practice who have had vaccine reactions, whose doctors blew it off, didn't report it, etc. And of course, there's always the potential that a person, since it's just a reporting of a incident, and of course, that doesn't mean that it's proof of cause. So there's also the potential in VAERS that people could be reporting things that weren't truly a seizure or not related, or they didn't remember, etc. Okay. And of course, maybe they would have had epilepsy anyways. But the thing that's different in this new research that I'm reporting on now, and this was a research, it was funded by the FDA, and there were over 4 million individuals in this study. Okay. And what they were looking at was databases from 3 large commercial insurance companies. Okay. Now, I realized that I just used the FDA and the commercial drug company, insurance companies as a data collecting. So do what you will with this information. But I also want to point out that they did report positive findings for side effects. So, I'm guessing if even, one of the things that I did see when I was reading it is that the researchers, as well as the articles and the media doing it, really downplayed it. They would use the term tiny, and they would also then go on to use things like the word harmless when referring to messenger RNA in the vaccines. They would use the word tiny piece of messenger RNA, which in fact, none of that's true. There's many, many pieces of messenger RNA in a COVID vaccine. Okay. And you certainly can't say it's harmless. We've known about the myocarditis anyways. So, I have a real difficult time reading studies or media articles when they use those types of subjective terms. So if you ever see the words completely harmless, completely safe, tiny, minuscule, look out for those types of words and actually go back to the research, the original papers, and see what the numbers actually are. Because again, I just see too much of this downplaying or underemphasizing. I don't say underreporting, underemphasizing of of vaccine reactions. Okay, so in this FDA-funded study, let's first talk about the myocarditis, which I mentioned before, because certainly in this database too, they said the same thing that all of the research has been showing now for the last couple of years. Myocarditis, especially in adolescents, especially in adolescent boys, is a real deal thing from the vaccine. Okay, it's almost like nobody's really debating that anymore. Certainly, there were lots of excuses and lots of trying to explain it away originally when there was the concern about myocarditis. But again, this is like right where the FDA is talking about now. They're saying it was a comparative value to what's been seen already. So I think, everybody's now acknowledging this is a real deal thing. And of course, when we're talking about the risk versus benefits and why people are questioning, giving a COVID vaccine to an adolescent male, especially if they're in health. Now, of course, if it's an obese, serious lung disease, serious immunological disease, that's different. Okay. But obviously adolescents as a whole, as well as young children, are incredibly unlikely to have serious problems from COVID, even before we had personal as well as herd immunity. Okay. But again, there's more information that, the risk versus benefit in particular with adolescent guys and young adults, that the risk versus benefit ratio is not as strong in favor of the vaccines as they originally let us believe, or maybe for other age populations or at-risk populations. Okay. Now, because of the fact that this was one study, though, as opposed to multiple studies, I want to comment about that, because one of the things you may have heard me say before is whenever there's one study that comes out, file it, acknowledge it, wait for more studies to come out. But now there's been 5, 10, 15 studies out about the myocarditis. So you can't just call it off the chance from what we're seeing. But now let's talk about the seizures. Okay. And in particular, in this 4 million person database, there was an increased signal specifically for young children in the 2 to 5 year old age group. And again, this was not looking at febrile seizures. This is looking at seizures and epileptic disorders that began in the 6 months following getting the COVID vaccine. They compared it at the time to people not getting the COVID vaccine. And what did they show? Is they showed that the kids who got the vaccines had a stronger signal that it was worthy of reporting to hear that compared to those in 2020 who had not gotten the vaccines, and how likely they would develop seizure disorders in the 6 months prior. Now, I do want to point out, because it's important to point out all the information that we have, that they did a regrouping of this in 2022. Okay. And in 2022, they did not show the same type in terms of the background. They did not show that much of a difference relative to theirs. So, of course, there's a big question that came into where was when people were getting the vaccine, but they didn't have prior immunity. What does that all mean? So again, I'm just reporting the facts as what they saw, but it was clear that, back in 2020, though, when people were more likely to be, physically distancing, wearing masks, not, being more in quarantines, etc., that there may be a different data set than what is happening, because obviously by 2022, and starting now, for most people, COVID is just a thing like the flu, and not many people are taking additional steps or anything else about it to try and ward it off. Most people are, if they have their immunity, that's great. Only 3% of people, as you may have heard, have actually gotten the booster for the newest booster that came out this fall for COVID vaccine, despite the fact that the recommendation from the CDC is everybody over 6 months of age get the vaccine, but 3% of people have uptaken it, and that's more commonly seen in the elderly or people at high risk, which we've talked about may be a group of people that might get more benefit compared to the risk. Okay, so what's my takeaway? Okay, interpret these results with caution, because this particular study was just one, right? It wasn't the multitudes like we had seen with the myocarditis, but the signal was there. Okay, but overall, it still comes down to what's the potential risk versus the potential benefit. And anybody who is saying that the benefit from the vaccine now compared to what the benefit from a vaccine would have been back in 2020, 2021, being that 96% of people have documented immunity now, combined with the fact that the COVID vaccines are a milder disease itself compared to the original ones, as we went through the original strains to alpha, beta, delta, but we know in the age of Omicron that it's not the same level of severity, and that is, of course, the reason why we are hearing about so few deaths from COVID, despite the fact that few people are getting the vaccine. So that's some information that's important when we're assessing this too. Anyways, I hope that gave you some information you didn't have, and maybe gave you some just more food for thought or immunity for thought. Have a nice day.